Nikki, I'm just going to rejoin in a moment. It's just my I'm connected by phone and it's just gone off my screen, so I won't be a moment.
No problem at all, Chelsea. Okay. So we'll just give it one more minute and then we'll make a start. Okay, so it's now 5 past. I think we're going to make a start now. So thank you very much for coming along to our webinar. We're thrilled to have you here. Hopefully we can tell you a little bit about our masters. So I'm in the second, I'm going to load up some slides and then I will introduce you to our presenters today. So I'm very pleased to let you know that most of the webinar is going to be run by some of our current students. So we have 2 of our second year students, Jess and Chelsea, and then hopefully one of our third years, Emily, who will be joining us as well to tell you a little bit about what it's like to study the masters and what it means for the longer term. Okay, so Jess, I'm just going to open up my slides now. And can you see those all right, Jess?
I can, yes.
Perfect. So if you have any questions, please type them into the Q&A and we'll be happy to answer them either as we go along or at the end. And I'm going to hand over now to Jess.
Well, thank you, Nikki. Welcome, everybody. For this webinar, we're hopefully going to be talking about what genetic counsellors actually do in the NHS. A little bit of an overview about the masters that Cardiff offers, including the modules, perhaps including some tips about that blended learning and some of our own experiences about being on the actual course and also doing placement and some other tips and tricks when it comes to applying as well for the masters. Nikki, if we could go to the next slide, please. Thank you. So genetic counsellors work within a clinical genetic service, and the clinical genetic service department as a whole provides specialist advice and services for patients and the families who are affected or at risk of genetic conditions. So there's lots of different types of genetic testing. A diagnostic genetic test is if, for example, somebody already has a cancer, we can offer genetic testing to see if there's a genetic reason why they have cancer. Predictive genetic testing is if there's a known family history of a genetic condition, but that individual doesn't actually have any signs or symptoms, we can kind of predict how do they have the variant and whether they need any additional care. Carrier testing is for couples that might be at risk of having an affected child. And sometimes we have pregnant people coming into our clinic saying that they are pregnant and we can offer genetic testing to them. We're made of a bunch of different in-clinical genetic service. We work with doctors, of course, other genetic counsellors, with genomic practitioners, genetic information nurses, and of course our important admin and secretarial support. Because we just kind of communicate the results to patients and talk about testing options to patients, it's actually the laboratory team that really analyze the DNA to find if there are any genetic changes. So we work really closely with the clinical scientists there. Nowadays, we're also doing something called mainstreaming. So that's where other teams and specialties can actually send a patient for genetic testing. So we have a lot of referrals going in and out our 2 departments, including cardiology, oncology, and fetal medicine. Next slide, please. So the types of patients that we see really vary throughout the day and also throughout the week. I have some examples of the different types of patients we might see here, and it just kind of illustrates the different genetic testing we might offer to these patients. So, for example, starting at the top, a patient has been diagnosed with a young prostate cancer at 35. So prostate cancer at 35 that's kind of suspicious that it might be a genetic reason. So we would go for diagnostic testing in that. Going towards the left, a patient is 20 weeks pregnant and was referred to genetics after differences were detected in her most recent scan. So that's another example of why we might see a patient in clinic. It might also be that they are a child with a developmental delay, and there might be a genetic reason for that. So we'll probably speak to the parents and see if they would want to find if there is a genetic reason. An example of carrier testing is if a patient is a couple and they know that they both carry the cystic fibrosis variant. And so to not have an affected child, since we already know their status, it might not be talking about genetic testing options, but it might be talking about reproductive options, what they can do to perhaps minimize the chance of having an affected child. Going kind of back up to the top at around 1 o'clock, patient is 12 years old and his father is affected by hypertrophic cardiomyopathy. So sometimes we see children in our clinics as well. And for example, with cardiomyopathy, screening starts around 10. So we would want to see a patient when they're in their teens to talk about screening if they're at risk. Patient has known for many years that they're at risk of Huntington's disease and would like to know more about testing options. So with this patient, they have a family history of a genetic condition. So we might see them in our clinic to talk about, do they want testing or do they not want testing? And then the last one there is an example of mainstreaming. So this patient might have been diagnosed with cancer, and then the oncology team might have requested a genetic test and found that there's a BRCA1 variant. So it's all well and good that the patient themselves know that they have a BRCA1 variant, but we will see them as a genetic counselor to kind of talk about the implications for their wider family. Who else might want to be tested for the BRCA1 variant? Thank you. Next slide, please. So what do we do as genetic counselors specifically? So we do our best to communicate all of the science and the genetics and medical informations to patients in an understandable and relevant way. We help patients understand the inheritance. So sometimes genetic conditions pass in a dominant way or a recessive way or all other sorts of ways, and we try and explain that to them so that they can understand their own risk and their risk to the rest of their family. And also the recurrence risk. So if they have an affected child, what's the likelihood that a couple might have another affected child? We discuss the potential implications of a genetic diagnosis for their future health, surveillance, and management options. So if a lady has been diagnosed with BRCA1, what does that mean for them going forward? If they already have a cancer, what does that mean for their treatment plan, for example? Explore the psychological and social impacts of a genetic diagnosis. This is quite a big one that we especially talk about in year 1 and also in year 2, because being told that you have an increased risk of something, or in the case of Huntington's disease, for example, that if you have the gene variant, you're definitely going to experience symptoms of Huntington's disease that can be really life-changing. And so not only do we talk about the medical aspect, but what might their experience be like in the future if they are told that kind of information. Discuss the family implications of a genetic diagnosis and support patients in how to talk to their relatives. For some families, they don't really talk about medical, like going to the GP, they're not that open. But when it comes to genetic information that's shared among a family, we can help support patients in communicating that to the rest of their relatives. And one thing that is almost kind of drilled down into us is what we're there for. We're not there to tell them what is right, what is wrong, whether to go for testing, whether to not go for testing. Our main role is to help patients reach a decision which is right for them. And that kind of takes into, I feel like that's kind of like the main aim for each clinical discussion that we have. Next, please. So hopefully that kind of gives an idea and kind of entices you to want to know more about being a genetic counsellor. So from what I understand, there are really only two routes in the UK to become a genetic counsellor. One is the scientific training programme, and the other is Cardiff through their masters. So it is a master's degree delivered by Cardiff University School of Medicine. It's an accredited degree, meaning that it's recognised not only by the UK registration board for genetic counsellors, but also by the European board. And Nikki will correct me if I'm wrong, but I think that means that you'll be able to work in Europe as well. It is, the degree is 3 years part-time with around 2 to 3 days of independent studying a week. It's a distant learning, meaning that wherever you are in the UK or even in the world, you can study from there, with the exception of 2 teaching blocks in year 1 and year 2 and 1 in year 3. So that just means that for about a week or a week and a half or so, you travel down to Cardiff, meet the rest of your student peers, and then it's quite focused with lectures 9 to 5, but really, really interesting. We'll talk more about what the teaching blocks cover. It is self-funded, and so if you're in the UK, you can have access to Student Finance England. There's some links on Cardiff about Guide to Postgraduate Funding. There are links about the scholarships and alumni discounts, but I don't think that covers this degree because it is distant learning. But I was able to work in my first year because of the part-time nature. When you finish the degree, you are essentially pre-registered genetic counsellor, which means that you can apply to Band 6, I think. Is that correct, Nikki? Yep. Band 6 within the NHS banding. And then Nikki will talk about what it means to be a registered genetic counsellor later on. Okay, next, please. So this is kind of an overview of what to look forward to on the masters. So in year 1, it is really laying the foundation. So it's understanding genetics, understanding the different inheritance patterns, understanding what makes some genetic changes pathogenic or disease causing, and what makes others benign or not related to any disease. And of course, the grey area sweet spot in the middle. There's some basic maths learning with regards to calculating risks, so kind of talking about ratios, percentages, and it's introducing and practicing counselling skills. And again, there are 2 teaching blocks, face-to-face teaching blocks in year 1. Year 2 is where me and Chelsea are at now. So I'm just coming up to the end of my clinical placement, which has been great. Happy to answer any questions. Essentially, it's applying what we've learnt in year 1 to real life scenarios with real life patients and kind of understanding the general workflow of a genetic counsellor. We're still kind of going through lectures, and the assessments that are in year 2 are modelled after what we would normally do for registration. So it's just a really great opportunity to kind of prepare for the future. And then in year 3, you go off and do your own individual work on the dissertations that you've picked for yourself in year 2. And yes, I think that's all for the interview. Next one, please. For the overview, sorry. So applying to Cardiff, I'm not sure if these are the same, if these have changed, so Nikki can correct me. But you'll need a 2-1 degree in a relevant subject, a caring experience, up to 800 hours or equivalent to 6 months full-time work, an academic reference, and a personal statement. And I believe the questions they ask you things like, what are your strengths? And it would be really good if you could showcase some of your counselling skills as well. Once you kind of submit your application, the interviews were around April, May when I was applying. And And in the interview, they'll ask you some questions about, what do you know about genetics? What kind of genetic testing is there? Hint, hint, I've already given you the answers. And they'll ask, I don't know if it's going to change, but there was a reflection piece as well where we had to kind of write an essay about what's happened in our lives, and what we learned from that, how we grew from that. And there's also a 5-minute presentation. Again, this is what I went through. Nikki can let us know if that changes. And during the interview, they find it really helpful if you already know where you would like your placement. So you don't need to contact any genetics services, but you can kind of have a look in your area. If, for example, I live in Nottingham and there's a clinical genetics department here. So it was really helpful for me to tell them I'd like to stay in Nottingham if that's possible. And then they'll kind of arrange that in the background. I guess some main tips when it comes to the application, and most specifically the reflection part, is not necessarily just saying, this is what went wrong, this is what I learned from it, but it could also be really helpful to self-reflect on, this is what happened. I was thinking, it made me angry, or I felt a certain way, and that taught me something about myself. And because I know this about myself, this is how I go forward with my work. Next slide, please, Nikki. So when it comes to building more practical, relevant experience, you could have caring experience. So I was a carer in a palliative care home, and that really helped. You can also work with charities, talking to people that have inherited conditions. So these can be telephone counselling services, social work, or working with young people volunteering in a hospital. Teaching assistant can also be a really helpful experience when it comes to caring work, especially because you're dealing with children, and that might change your approach. I did a counselling course, which I found really helpful. So you could have a look to see what courses are offered by local colleges or sixth forms. Some paid or voluntary work have the option of doing a counselling course as well. And there's a website called FutureLearn, where they have an introduction to genetics, which I know that some people have found helpful. And then there's the Genomics education program as well, where there's little courses on how to draw a family pedigree or like a family tree, for example. And also, if you'd like, you can attend conferences and possibly speak to people that are already in the workspace. I think that's all from me. But yes, thank you. There are some websites as well to where you can have a look to kind of help build your application as well.
Brilliant. Thank you very much, Jess. So I think, Chelsea, we're moving on to you next. So just to bring you in, and Chelsea's had to log on her phone, but hopefully everything will go to plan and we'll see how we get on. So over to you, Chelsea.
Oh, that's great. Thanks, Nikki. So yeah, if we could just go on to the next slide, as Jessica said, here there are some really helpful links and things for those that are considering applying for the programme. But I thought it would be helpful to give a bit of an overview on the modules and assessments that you can expect to encounter. So I've essentially done something very similar to a word cloud, which I've tried to make each type of assessment bigger depending on how much they contribute to your final grade, but also how many of those you can expect to encounter throughout. And I think one of the things that really struck me when I started the programme was how varied the assessments were and how they all came in many different shapes and forms. So you have some assessments that are more traditional, such as your essays, and in first year there's an examination as well for 2 of the modules. So there's a probability exam and an exam on genomic sciences and molecular sciences as well. In the cohort that I'm in, we did that online, so it was a timed open book exam. so that's something worth considering as well. It's slightly different to maybe the in-person examinations that you may be more familiar with. So those are the two sort of more traditional ones, again with a research dissertation. Those of you that are kind of in third year of undergrad or have completed your undergrad, you may have already done a research dissertation, and this is something that we start working on in the second and third year of the master's programme. But some of the more alternative forms of assessments include things like presentations, patient leaflets, bioinformatic reports, skills observations. We do recorded counselling sessions where we counsel our peers based on a particular scenario. So that was something that kind of had to get used to, hearing myself back on a video, which is quite a funny scenario if you're not used to doing that. But yeah, so it's all very variable, the way that you're assessed, and I think that's one of the things that I've really enjoyed about the programme, is how I've learned so many different skills for assessments and things beyond just the conventional, essay and examination processes that you may be more familiar with. One of the big things I would say would be that reflection is quite key to the programme, and that's throughout all 3 years of your sort of studies. You will be asked to reflect on your skills, your development, your personal experiences, and share those either in the form of assessments with peers in a discussion or with your tutor, and that's really just to get you sort of prepared for when you do enter the world of working as a genetic counsellor, because reflections are really important to skill development, and it's something that is quite heavily focused on in the registration processes as well for genetic counsellors. Yeah, we can go on to the next slide now, Nikki, if that's okay. So another thing to sort of mention as well is the learning environment that comes through the masters. So I know Jess has briefly touched on the fact that it is kind of a blended learning environment, would be fair to say. As Jess said, there are some in-person teaching blocks that you need to be present for in Cardiff, and there's 5 of those in total across the 3 years. And the type of learning that you can expect when you're in person, again, is quite varied. There can be peer sessions where you're working with, in small groups. We call them triads, where you're practicing your skill sessions. So it will be, yourself and maybe 2 other students. But then there's also, whole classroom lectures that take place. There's also smaller group work where the tutors are there to support. So it's really varied throughout those teaching blocks how you will learn, and I think that's one of the reasons why you get to know people very, very quickly on this course, which is a big difference, I would say, from maybe conventional experiences with undergraduate degrees. Often, I think from my experience, I was just in a big lecture theatre with hundreds of students, and that's certainly not the experience that I've received on this master's. You work with people on your course very closely, which has been one of my favourite things about the course. As Jess said as well, there's also obviously that distance learning approach, which accounts for all of your other study beyond the teaching blocks. You can expect weekly live tutorials, so typically the group is split in half, and I mean, for our group it's Wednesday and Thursday, and you attend one of those, and it can include things like presentations from your peers, case discussions, assessment support. So it's very variable but really helpful throughout. We also arranged peer sort of counselling skill practice sessions as well in our year group, which I think is something that's encouraged for all year groups. Sort of between you all, obviously you practice those counselling skills whilst you're in person on the teaching block, but there's obviously 6 months or so between then and your next teaching block. So one of the things that we found really helpful was to have to have kind of Teams calls either weekly or monthly, where we could have, you know, scenarios and we would practice counselling each other just to kind of maintain those skills throughout the year. And I know some students will do local meetups as well. So I was really lucky that in my cohort there are 3 other students that are based in the Northwest. So we meet every couple of months or so just to kind of either have a catch up and do some uni work or things like that. So that's been a really nice experience. And I think a couple of other students on the course have been able to do that if they're London based, because we have a few London based students as well. So yeah, those are the kind of things to expect with the learning environment. I think the key thing to take away really would be that although a lot of the learning is done at a distance, I don't think that this course feels isolating or you feel like you're not part of a cohort at all. And I would actually say through this master's, I felt more involved with my cohort than I ever did in my undergraduate, which was face-to-face learning. So I think that's been a really big advantage of doing this programme. Nikki, I think you can go on to the next slide. Yeah, I think this one was where Emily was going to chat about her journey through the MSc. Is she here? Do we know?
Yes, she is.
Brilliant.
Right on cue. Thank you,
I'm
Chelsea.
very pleased to join you.
Over to you, Emily.
Thank you. So I'm Emily, and I actually only have a little bit left of the Masters now, which is quite scary to say because I've got quite a bit of work left to do on my dissertation. So I'm coming to the end of my 3rd year, and we've recently had our last in-person teaching block on the course. And in the last session, we all talked about our experience of the course, and it was actually really lovely. I think what really came across is that it's been like a journey for all of us. So I think a lot of people did say, you know, it is a very demanding course. And I think that is helpful to know from the outset. So you can kind of think about how it might fit in with other commitments you have. Every single person in the room talked about what a brilliant experience it's been. Everyone said it was so worth it and how far we've all come. And, you know, it was really emotional, actually, people thinking about, you know, how we were when we all started out and where we are now. And it was really obvious how big a part of people's lives this Masters has been. So I'm going to talk a bit about how the Masters fits in with life, particularly around 2 key stages, which are the placement and the dissertation. So when I applied and joined the course, I think it's already been mentioned that previous students have kind of reported the work as taking about 2 to 3 days a week for the sort of independent side. I think that does seem like a fair kind of benchmark. But it will be different for everyone. So, for example, I take absolutely ages over assessments, and there are quite a few. So there have been times when I've felt like I needed a bit more. But equally, my friend has a very scheduled approach, and she's able to stick to that really well and just get things done. So I think if you're thinking about applying, a good thing to think about in advance is kind of how you work and what's going on in your life and how those things might fit together. So, for example, other students in my cohort have had a variety of different working patterns. Some have worked full-time throughout the course. I've worked part-time. I've also got small children, and I need to factor in things like, you know, what they've got going on and the cost of childcare and things like that. So different people can kind of make it work in different ways, depending on how they kind of work best and what other life considerations they've got. I'll also say that I think the course teaches a lot of really helpful skills, you know, for example, about self-awareness, reflection and being organised, I think really help to kind of make things fit together. So in the first year, there are lots of assessments to think about, but it's also definitely something to think about for second year, because the placement, the 72 days has been mentioned. You might not necessarily know when you start exactly when in second year that's going to take place. So it can depend on things like the capacity and the service that you're joining. Some are able to offer lots of flexibility and part-time placements. Sometimes they might need you in full-time. From my experience, the services that are providing the placements do try to be as accommodating as possible and really helpful. But it's important to kind of think about how that might work alongside work commitments, for example, particularly because you might have to consider things like placement expenses. So a lot of this really depends on where you have your placement. So some placements will only require clinics within the centre that the service is based at. Sometimes there might be occasional homeworking. For other services, there can be the opportunity to attend other clinics in the region, for example. So I had an overall brilliant placement experience. It's a really nice feeling if you've not come from a clinical role before, to meet your first patient in the waiting room for the first time and take them through into clinic. But it can also feel quite intense sometimes, because especially depending where your placement is, you might need to, when your placement is in the course, you might need to work along with other assessments and things at the same time. So I actually had a split placement. So I had one that was specifically prenatal, and then a half placement at a regional genetics service. So that's the kind of the placement side, which I think is a highlight for a lot of people. But another kind of key stage is the dissertation year. So I know some people will have done research as part of their undergraduate, but for me, this was a really exciting opportunity to kind of go out and do actual research. And again, when I first interviewed a participant, it felt a little bit like the first time of calling a patient from the waiting room. Most of the students, not all, but most, do a qualitative research project. So that might involve, for example, interviewing people with a condition, about their experience, or about their perceptions of something. And I think I was probably guilty of thinking it was just a dissertation. And I think for some students, it perhaps does take less time than some of the work in the first 2 years. That hasn't really been the case for me. I think probably because there's a lot of factors outside of your control when you're kind of running a research project. So, for example, for this kind of project, I needed approval from the University School of Medicine Ethics Committee, which most of us did, and that sometimes can be quite a long process. Then I found that the recruitment was a bit slower than what I thought. So there have been times when I did have other things to get on with, but it was kind of unavoidably slower than other times. So at the moment, I'm really busy with analysing and writing up the results. But just like the rest of the course, it's been a real learning process. So all of the students have got a dissertation supervisor. And when I first met mine, I think one of the first things he said was, "Oh, it's more about the process really than like the end result." And I kind of nodded and I smiled and I was like, "Yeah, okay, but I do want to get a good project." But honestly, he was really right. I've learned so much about it, from things that I do differently next time, even the way I think about research and the kinds of philosophies underlying it. But I've also learned so much from my participants, and it's been a real privilege for them to kind of share their time, helping me to kind of get an insight into their lives. So again, everyone's dissertation experience is different, and some people have found it harder to recruit participants or might experience other difficulties. But next slide, please, Nikki. I think the main thing that's really helped us through these kind of difficulties, or maybe not just difficulties, but perhaps challenges, is whether it's been with the dissertation or the placement or assessments in general, everything was really helpful has been the support. So I think it's kind of been touched on already, but our cohort has been incredibly supportive of each other. Although I can't speak for other cohorts, I think people that are drawn to genetic counselling are naturally empathetic and supportive. So there's been lots of really strong friendships that have been formed. We've all learned a huge amount from each other, and we've got people from all kinds of different backgrounds on the course, which has been really nice to kind of be a big part of. And you'll have generally 2 student reps for each cohort. So these are people that would volunteer with a kind of group's agreement. And I've been lucky enough to be a student rep throughout the course. So we meet termly with I think it's termly, is it, Nikki? Termly? with the programme team and the other reps, so we can discuss things like student feedback and take proposed changes to the course. I wouldn't talk about things like proposed changes to the course. So there are formal ways that students can give feedback to their rep to take forward. I also think, from my experience, it's just been really helpful to kind of be in touch with the group in general, to kind of understand what the vibe is and be able to communicate that with the programme team when needed. And they are honestly so open and responsive and prepared to make adjustments when needed. Obviously, sometimes a cohort might want something that's not possible or isn't going to be done, but the communication with the programme team has always been very open and very helpful, and that was something else that really came across in our last teaching block when we all talked about what our experience had been. Everyone's got a personal tutor on the course, but members of the academic team are always happy to discuss things like assessments or anything else that you might be concerned about. So, for example, Nikki very kindly gave me a fresh perspective on my dissertation before Christmas, which I found really useful. There is also the University Student Connect and the Students' Union. I've not had any personal experience of them, but I think some students in the cohort have found them helpful. So I guess all in all, the course is a journey and it can sometimes be a bit uphill or winding, but it is so worth it and there's lots of support on the way. So you'll find you'll learn things that you never even thought that you would be learning about.
Yeah, I just wanted to add finally that, you know, a little bit of sort of an insight into what you can expect after the master's programme as well. I know we've touched on a little bit about kind of registration and things like that, but once you have finished the master's programme, you're then able to apply for pre-registration genetic counsellor jobs across the UK NHS clinical genetics services. As Jess touched on, the programme is accredited within Europe as well, so that may be an option for some people, but just speaking kind of UK based, those are the roles you'll be able to apply for, and they're typically band 6 roles, and they're usually on a fixed term basis, because it takes 2 to 3 years to complete in-post training and registration requirements after completing the master's programme, and that then allows you to become a registered genetic counsellor, which are typically employed in the NHS at a band 7. I guess the main sort of difference between those two is that registered genetic counsellors are independent, and they work on their own caseload, and they may have other responsibilities like mentoring students and things like that, whereas pre-registration genetic counsellors are still within the training process, and quite often when you're employed by an NHS-based clinical genetic service, you'll do rotations through the different aspects of clinical genetics, which I think is one of the really nice things about the way of becoming a genetic counsellor. I think that, you know, in some ways you can look at it and think it is a long journey, which it is, but the nature of support that you receive through kind of the master's programme and then into, you know, becoming sort of an independent registered genetic counsellor is there, and it's always very training focused, so that's a big advantage. So yeah, as I say, you're able to apply for those jobs once you've finished the master's programme. There are other NHS roles that some people may go into as well, such as genomic associates, genomic practitioners and family history coordinators, and that might be to gain some more experience as sort of working in a clinical genetics service after the master's programme, and it's also a really good opportunity to get your foot in the door as well of a genetic service if, say for example, the genetic service you want to work in doesn't have any vacancies for pre-registration genetic counsellors. You may be able to apply for other jobs instead, where you can get to know the team and then hopefully be the first to be made aware of any vacancies coming up where you may be able to apply. There are other sort of directions people may go into as well, such as research roles, so people can complete a PhD at the same time as working as a pre-registration genetic counsellor, and I know this because there's someone in our service who's doing that at the moment. So, you know, for those that are really keen to stay within academia and stay kind of in the loop with that side of things, there are opportunities to be able to do that as well. You know, these are just the 3 sort of main ones that I've mentioned here, but obviously there are other ways that you can use your masters after completing the programme. So yeah, it opens up a lot of doors for you. I think that's all I really wanted to say on that slide. Yeah, I think that could be it from us.
Thank you very much to all of you. So just to finish off, I'm going to talk about a couple of things. I realise I should have introduced myself at the beginning. My name's Nikki Taverner, so I'm the Programme Director of the Masters. But I hope you've enjoyed hearing from our students who can really tell you what it's like on the programme. People often have a few questions around registration that Jess and Chelsea have already talked a little bit about. So just to say that in the UK, there are two different routes to registration at the moment. So Jess touched on this briefly. So one is via the Genetic Counsellor Registration Advisory Board, or GCRAB, and that's to enter a voluntary register as a genetic counsellor. And many of the sort of genetic counsellors who've been in the profession for a while are registered by that route because that's been around for longer. So I myself am currently registered that way. And then there's also a new route called the Scientist Training Programme Equivalence route, and this is obtaining statutory registration as a clinical scientist in genomic counselling. So you may have seen that in England, you can train to be a genetic counsellor or a genomic counsellor via the Scientist Training Programme route, and this is they achieve this registration at the end, and we can work towards that once we've graduated from this Masters as well. So two different routes there, and as Chelsea said, you need to gain some experience in order to do that. So the Masters provides you with the academic requirements, and that's why we have our accreditation, and then you need to gain that experience in order to put together your portfolio for one of these routes. You can also register elsewhere. So again, as been mentioned before, you can register with the European Board of Medical Genetics, the Genetic Nurses and Counsellors Division. So our programme is accredited by them. So again, you get the academic component from us, and then get some experience in a pre-registration role as you work towards that. And graduates are also eligible to become registered elsewhere. So in other countries. So for example, quite a few of our graduates in the past over the years have done the Canadian board registration, where you have to do an exam to become registered there, or have become registered in Australia. So there are different routes available wherever you are in the world. And then building a little bit on what Chelsea was just saying about career pathways. So she sort of talked about where people tend to go sort of straight after they've completed the Masters. And I think most people come into the MSc thinking they would like to work clinically as a genetic counsellor, which is fantastic. But there are also these other routes as well. So some people work within those regional genomic services, so the sort of main centres across, for example, the UK and Ireland for the NHS, where you can do a range of genetics and genomics and work as a genetic counsellor there. Or also there's other NHS settings. So for example, Jess mentioned mainstreaming. So this would be, for example, being placed in a specialist hospital, for example, around and doing cardiac work or prenatal work, for example. There's roles in private healthcare, and then there's other roles around education and research, policy development. Some genetic counsellors work for charity. So it does open up a lot of windows and routes and doors into new things. I think most people come in planning to work within the NHS, and that's great because it's a really important part of what we do. But there's a lot more to it as well, and lots more different things that you can consider as you go through the Masters and then beyond. And that brings us to the end of our slides. So I'm going to stop sharing the slides now, and you've got myself, Jess, Chelsea and Emily here to have a look at any questions. I'm going to see if there's anything been put in the chat. Okay. So having a look at the most recent question. So this is a 3-year part-time programme. So we cover the same content really that a 2-year full-time Masters programme would complete, and therefore you get the same level of education as would be required for a sort of 2-year full-time Masters programme. So it should be just as competitive for going for PhDs. In terms of accessing PhDs, sort of genetic counselling ones specifically, there aren't sort of really strongly pre-established routes for obtaining that kind of funding. But there are some very research active genetic counsellors within the UK who've sort of set up a network where people can get in touch and find out more about how they might be able to get involved with that. And with genetics and genomics and genetic counselling expanding, we hope there'll be more research posts available in the future as well. Any other questions from anyone? Nope, looks like we've managed to answer most of your questions. So I hope that you are interested in applying. If you do have any questions, please do contact us directly. I did put my email address in one of the Q&A answers. So please do feel you can get in touch there. Just another question there around conflict of interest about doing the placement with a service where you're currently a patient. It's a good question. It's not something we've come up with before. I think what we would need to consider there would be sort of having a discussion with the applicant and also with the placement provider, with the service, to discuss whether that was felt to be appropriate. I would imagine there would be ways to manage that because we're used to having to consider these kind of issues. Ethics is something that we really think about a lot within the programme. And so it might be that the centre and the applicant would be able to come to an agreement where that was possible. So I would hope that that would be manageable with discussion. So teaching blocks, does one of the students want to answer this? That's not all from me. Does anyone want to volunteer to answer that question?
I think in the first year, the first teaching block was about a week and a half. And then it was a week. And then the one that we just had recently was also a week. So essentially it's between a week and a half and like 5 days.
Yeah, absolutely. Yeah, that's right, Jess. So yes, there's 2 blocks in the first year, and each of those is that week and a half, like Jess said. So it's 8 working days. So 5 days 1 week and then 3 days the following week. In year 2, there are 2 blocks, each of which are 5 days. And so one of those is sort of November time, and then one more around sort of April time. And then Emily, do you want to talk briefly about the 3rd year block?
I was just trying to remember how long it was, but it was 4 days, wasn't it, Nikki? So it was Tuesday to Friday, and we did a lot of dissertation presentations. So it was really nice to hear from everyone what they've been doing with the research, and we had other things as well, sort of patient experiences and things like that. So it was a really nice last block, actually.
That's good. So a lot of the stuff we do in teaching blocks is around the counselling skills, so get you those skills to do things in person. So the first year blocks are sort of roughly half of that, and then half of thinking about genetic counselling as a whole. Then the year 2 blocks, we have one which is entirely around the counselling aspects. That's our advanced counselling skills block of a week. We have an ethics block of a week where we talk a lot about the sort of ethics around genetic counselling. And then, as Emily said, in the final year, a lot of it's around dissertation presentations, so giving people that opportunity to present their research in like a sort of mini conference style, but then also some additional things around counselling and patient experiences, as Emily said. Okay, in terms of the references for the application, you can have as many references as you like. So we do have to have references to evidence all of the caring experience that you need to demonstrate. And so often people need to have several references there to demonstrate all of that, because obviously 6 months full-time equivalence is quite a lot. So usually most people do one academic reference, and they might do several for the caring experience as well. 1 second, just reading the next one. So in terms of the UK placements, up until now, the vast majority of our placements have been within the NHS services. We are open to doing them with private healthcare as well, and that is something we've been exploring. And we're happy to work with companies as long as they're able to provide, the requirements of the placement, which are covered within our placement document. So we do have people who've done placements with private healthcare overseas, understandably, because many overseas places are private. So we're definitely looking into that. And working with applicants to work out what's best for them. And then in terms of current applicants, so the closing date's on the 31st of March. So after that, shortlisting will take place. And so around about 2 weeks after that, successful applicants will be notified about the interview dates. They will then need to sign up for the interview date that suits them, which will take place online. And then after the interviews are finished, which are stretched out over a period of weeks, so unfortunately people do have to wait quite a long time after interview, because we have to complete those before we get in touch with people. At that point, we then get in touch with those who'd been successful at interview to start to talk to them about placements, because we have to make sure everyone has a placement that they're satisfied with before they start the programme, because if we had someone starting the programme and then they weren't able to do their placement, they wouldn't be able to complete the programme. So it is a rather long drawn out process, but in terms of your initial application, around the middle of April will be when you'll hear if you've been invited to interview. Now here's a question for you guys. So did you go straight into the Masters from your undergraduate degree? If not, what experience or work did you do in that period between undergraduate and Masters? And did that sort of thing help with your application? So who'd like to go first on that one?
I don't mind speaking. So I'm quite a bit older, so I didn't go straight into the Masters from my undergraduate degree. In fact, my undergraduate degree was, I'd say it's related, but it's not sort of like an obviously related course. So I keen to study in the course because of my own family's experiences. So the experience when I decided that's what I wanted to do, I did a PG cert in genomic medicine, which I know is separate from the question, but in terms of the experience, I worked at a care home for adults with a learning disability and also at a school for children with special educational needs. And I did a little bit of work with the charity, I think it's a charity, with Shout, the text helpline service. And I found the experience was really worthwhile, like on its own merits, which I kind of thought it would be, but I have to admit I was kind of thinking, right, I need to get this experience to apply to the course, and I didn't realise how much I would gain from doing the experience. So I think when sort of thinking about what experience you're going to look for, although again it's sort of a bit of a logistical exercise sometimes fitting that in around other commitments, it's worth seeing what you think you'll get the most from and what's going to be most helpful to you on the course, because I definitely learned a huge amount from the places where I did my experience.
Chelsea or Jess, I don't know if you want to say. Chelsea?
Yes, so I didn't apply straight after my undergraduate degree. So straight after undergraduate, I went to a different master's. So I did a different master's in genomic medicine. So I did that part-time for 2 years. And at the same time of doing that, I had 2 different jobs. So the first job that I had for a year was working as a science technician in a secondary school. That was really valuable. Just I think from like a nostalgia point of view, it was really enjoyable because you get to see all the behind the scenes of the science experiments you did when you were younger. But also, you know, you're able to, particularly in the school that I worked in, I did a lot to do with like science club, study days after, you know, study revision classes and things like that after school. So I was able to get involved quite a lot with the students learning, which was really nice. So I did that for a year, and then in the second year of my genomic medicine masters, I worked full-time as a family history coordinator at the All Wales Medical Genetics Service, which I'm not sure, you may or may not be familiar with the role of a family history coordinator, but it's very similar to others advertised across the NHS in England, which may be called things like genomic associate and genomic practitioner. So I worked within the service to get sort of family history information from patients who would be going to clinic or having their family history assessed, which gave me really good experience then for the application process.
Thank you, Lexi. I think for myself, I didn't apply straight after my undergrad. I took some time out, especially because it was around about where COVID was happening as well. So life was essentially on hold anyway. But I did a level 2 and a level 3 counselling diploma, which helped kind of introduce me to counselling skills, and that really helped with being reflective in the application, I think. I was also a carer in a palliative care home, and I think another thing that really helped was I volunteered for Childline, and Childline does also give you kind of like training in listening skills and counselling. So again, that really helped kind of build my application and also get me through the interview. And it's definitely still been helpful seeing patients in clinic now. I've definitely kind of built on all of those kind of experiences, and it's all come, it's all been really useful.
Thank you all. Okay, I think that might be all the questions we have for now. There are a few other ones that I've answered in the chat. I'm aware we're coming up to 1 o'clock. So thank you very much for coming along. I hope you're interested in the programme. And as I say, do get in touch if you have any questions. Thank you very much to Jess, Chelsea and Emily. Really appreciate you coming and telling everyone about it today. And I'm sure that they'll appreciate hearing what the experience is like from your side rather than me just talking about it. So thank you, everyone. All the best, and hope to hear from you all soon. Thanks now. Bye.
Best of luck.
Bye.